That original variant was predominantly affecting older individuals. So the initial deaths that we saw and hospitalizations we saw were virtually all chronically ill patients that were in nursing homes. After the push to develop a vaccine was successful and people began to get vaccinated, the numbers of people that were presenting with serious COVID complications went down dramatically. By June, we had virtually only a couple of patients in the hospital with COVID. The trouble with viruses is that when they are actively spreading in the community, they can mutate so that they are more effective in their ability to transmit. And that's exactly what happened, is that this so-called Delta variant that we're all dealing with now rapidly spread around the globe. And the original variant from Wuhan, the Alpha variant, on average about if a person got infected, they would infect one other person. And with this Delta variant, it is present in the nasal passages of infected people at such a high concentration that it very easily spreads. And on average now, 7 people can be infected by 1. And the virus has changed such that it's almost as transmissible as the childhood illness of chickenpox used to be. The Delta variant is now affecting younger people. They tend not to get as sick as older, but some young people do get sick and are hospitalized and died, and even can affect children. And so what we're beginning to see now is that the pandemic has become a pandemic of the unvaccinated. The vaccines that have been available to everyone free of charge since the early spring are preventing serious infection. People can still get infected with the COVID-19 virus, but they don't get sick. So the people that we're seeing in the hospital now, virtually all the people that we're seeing are unvaccinated, either too young to be vaccinated or by choice deciding not to become vaccinated. We now know for sure that the vaccines work because 95% of people we're seeing in the hospital here in Seguin, throughout the state of Texas, throughout the country are unvaccinated. And the only way we're going to get out of this pandemic is through immunity. Immunity either through having acquired the disease and now have immunity, or immunity through vaccination. And of course, it's preferable to have immunity through vaccination because you don't take the risk of dying from COVID-19 if you become infected.